The following is being brought to you by VerticalVet. Rethink your GPO.
Hello, good evening, my veterinary family. I'm Dr. Ernie Ward, and on behalf of VerticalVet, I want to welcome you to this very special Facebook Live event. If this is your first time, each month we hold a couple of these. They're private, exclusive membership benefit, but tonight it's a little bit different, and I really wish we weren't having to have this. But before we get started tonight, I do want to begin by stating that these are unprecedented times. It goes without saying, no one has ever experienced something of this magnitude, and there's a lot of unknowns and uncertainties. And so tonight, what I'm trying to do is establish, a community here, a resource that we can learn from each other as we get through this. Current projections show that we will be tremendously disrupted in our daily lives and practices at least until the end of April. I think that's the most optimistic of all of the forecasts. I think that many people are concerned this could easily wage into June. So having said that, we will get through it. We are Americans after all, and we do best when we are challenged. We are resilient. Our profession is strong. The fundamentals of our country's economy and our practices are sound. So I'm very, very optimistic. I also want to let you know that this is the beginning of a string of lives that we will be bringing to you if you're interested. So one of the things that we're thinking about for next week is to have a legal expert on. We were going to do that tonight, but quite frankly, there's still so much up in the air as far as what's happening with some of the actions we'll talk about tonight with the federal government, state governments, even just how we're going to handle unemployment, sick leave. Tonight I will be touching on what we know, but if you're interested in that, I want you to please at the end of this or sometime just say, Casey, we'd like to continue this. So if you're interested next week, we could have a legal expert on. We're going to also be asking for a lot of help in suggestions, questions, and so forth. And we may even move to another platform if we find that you're really engaged. Obviously, we wanted to get this out as quickly as possible to as many of our members as we could. And so we're choosing the Facebook Live. But obviously, I'd much rather be looking at you face to face and hearing your voices. But we will work through that as we move forward. I guess I want to start off by just asking a couple of questions. We want to know, again, where you are. I'll be scrolling through all of these. Looks like we've got a great scattering all over the Southeast United States for sure. But I want to ask you, have any of your staff been diagnosed with COVID-19? I think that's really where I'd like to begin tonight. Are you personally being affected by this? Is this something that you're seeing? Laura, my wife, many of you hear me mention her in lots of my podcasts and videos and writings throughout the years. Many of you have met Laura, so she'll be sort of adding comments throughout and adding that. But have you seen this in your clinic? I was just speaking with a veterinarian in Seattle earlier this week, and half of his staff is out. Quarantine, mandatory quarantine. Wisconsin, no. Nicole says no. So again, just hit us up here. We want to see if you've had it. South Carolina, no. One thing to note, I think we are so early in this. Yes, there's Tracy Walsh says yes. We're so early in this, and I had some graphs that I was going to show you tonight, but I think we may save that for next week because, again, the data is so incomplete. None in Bettendorf, Iowa. Thanks, Rusty, for adding that in. We aren't testing enough. I think you guys are seeing this in the news. I don't want to belabor that point, but we're really early in the course of the pandemic, but we don't have a good scope on it. So the great news is, no, we're not seeing a lot of it yet. Primarily, we're in the Southeastern United States. Little River, South Carolina, just across from where I am. No, but we have one sick under quarantine. Don't think she's symptomatic enough. Again, this is one of the big challenges and obstacles we've got to overcome is just we don't have adequate testing. So, okay, so the next question is, what about any friends or family? That was our staff member. So have you seen have you heard about anybody, that you love? Have they been diagnosed with that? So, Laura, if you could put that question up there real quick. Okay. So if you've seen any of your family or friends, let us know. And then I think, let's see if anybody's friends or family. No family. Thank goodness, Trisha. I'm with you on that for sure. One of the things, if you look at the R naught, or the number of people that will be infected by one in person with COVID-19, as you know, it's over 2. In fact, some estimates place it as high as 3. So that means that every person who contracts coronavirus infection is going to spread it to 2 to 3 people. Mally, I'm so sorry. Brandy, I'm agreeing with you. No, thank goodness. I have an elderly mother with an existing pulmonary condition. So yeah, we don't want to do this. And then finally, let's one more time, Laura, if we could, let's ask about the, have you seen any decline in your practice? I think that's really also where I want to kick off. I know that some of you had mentioned earlier no, and that things were going great, and I'm super happy to hear that. But I want to just see if there's anybody that's maybe already seen a dip. As I mentioned, that clinic in Seattle, they're all but closed right now. I also spoke with a colleague in France day before yesterday, and they are mandatory closing there. So obviously they are really really hurting over in France right now. So anybody experienced a decline? Okay, well, let's move into some of the things. There are 2 resources that I want to make sure Laura shares with you guys links to. About a week ago, I wrote, you might have seen this, NAVC put it out first of this week. I wrote a guide on practices and how they can handle COVID-19. And it was kind of a pretty long document, but I tried to piece together lessons I learned from hurricanes here on the southeastern coast of North Carolina, and of course dealing with both SARS and H1N1, as many of you have. So I tried to compile all the resources that we had used to successfully navigate those times, and obviously nothing compared to what we're dealing with today, but I did have a couple of them. So the first one that Laura will put up here, this is on telemedicine. Let me go back to here. There we go. The first one that NAVC, and they shared links to both of these this week. The first one is an article there, and again, you don't have to get this down later. You can go and click on these links, and then there's a nice coronavirus catalyst for telemedicine, which I think if you guys are interested, I'd love to do a special Facebook Live on telemedicine. That prompted in North Carolina, from what I was told, the North Carolina Veterinary Medical Board to make a statement about it. But the reality is we're on good footing with our existing clients. So let's jump into this. The first thing we have to focus on is our employee safety. And so I think that you need to be aware you have a legal obligation to your staff to keep them safe. And right now, when you go back and look at this article, you're going to see some of the legal precedents that we learned from SARS, the first SARS outbreak in 0809. I'm sorry, 0203. We learned a lot about what employees deserve in the workplace. And so right now, OSHA is very, very clear on this. You must have a written policy in place now. So when you look at that document, I'll kind of give you the rough, sketches of what you should be having, but you need to do that now. That is a legal obligation. If you do not, later on, you could have a challenge because, as you'll see, the legislation that was passed yesterday or signed into law last night by our president didn't go quite as far as the original House bill. I think a lot of people saw the first draft legislation that came out over the weekend and thought, oh, this is going to be the law. And in fact, there were significant changes, including, remember, we're sort of on the hook for the first 10 days of their sick pay during this. Now, there are some provisions with that. You will get some tax relief, but you do need to have a very clear policy. And some of these things also, remember that they have to be actionable. So OSHA and the lawsuits that were brought forth during SARS and H1N1 said that if you tell someone to practice good hygiene and wash their hands, for example, you have to be able to prove that they have access to ample soaps, water, hand sanitizer, and so forth. You really need to make sure that you're on top of. This is why this PPE or personal protective equipment issue or shortage that's being experienced by some parts of the country is such a big deal, because at the end of the day, if you cannot ensure the safety of your staff members, and this is in a wide variety of professions and industries, then they may not work. They may not have to work. Again, public shared surfaces. And so, Laura, I don't know if we can kind of put some of that. So be watching the comments. Laura will probably be putting some of that stuff on the screen as well. But door handles, counters, keyboards, telephones, and so forth must be regularly disinfected. And then finally, I think the one that started to get people's attention was I made a comment about, and I'll read from you my article that I wrote last week. Employees and clients have adequate physical space to practice social distancing and aren't forced into crowded spaces. Now, I was gleaning on the current social distancing requirements. People are saying 6 feet and so forth. But there could be a situation where two staff members, we all have small exam rooms, could be forced together. And certainly, we want to be cognizant of that, as well as clients. Again, I think at some point we have to sort of separate some of the legalities of this and actually look at the ethics and practicalities of it, especially during a pandemic. I will tell you this, it is very clear, the legal precedents are very, very clear that during national health emergencies such as this, the laws are pretty lax. And that's why you're seeing all of these different orders and rules and regulations and laxing of certain, rules and regulations just be wide open, because right now the federal government is saying, look, you guys really get this thing under control. I think the most important thing for keeping your team safe, and that is, if they have any symptoms, they must be sent home. Again, OSHA was very, very clear on this after the SARS and the H1N1 outbreak, that employers who either ignored or asked employees to stay on longer or can they come in sooner, they were legally liable. And again, we don't know how this will play out. Anybody that tells you they do is absolutely trying to sell you something, in my opinion. But what we're finding is that, on the other side of these types of crises, if you don't act in the absolute best interest, in the most conservative fashion possible, that's where liability starts to enter in. So it is true. I had a veterinarian, and I wrote this in the article. Your employees do not have a legal obligation to disclose a diagnosis of COVID-19. But I wrote in my article that they do have an ethical duty to protect the most vulnerable around us. So, again, there's some gray areas of this law. And in fact, we don't know. There may be a mandate coming forward that requires you to disclose this. But, having said that, right now we don't. If someone is diagnosed with COVID-19, they need to inform their employer. The health department may even do that. But then you have a legal obligation to inform your staff. And there's a lot of questions around this, but the law is very clear. You cannot disclose their identity. You have to legally have a responsibility and obligation to inform your other staff members that they are in presence of someone who had it. Because you might have heard this, and maybe this is just starting up on some of the epidemiology boards. You may have heard the 14 plus 14. And what that means is right now, health departments all across the country, and they're struggling with this. We're all trying to find our way. But let's say you have an employee who is diagnosed with COVID-19. They disclose it to you. They come in and they call you, hopefully, and they say, hey, I just got back my test results. I am confirmed positive COVID-19. Just want to let you know. Employer obligation now looks like this. It's a 14 plus 14. It's 14 days prior to that diagnosis. You need to work with that employee to identify contact tracing. So all of the people that they worked with in the prior 14 days before the diagnosis, you have to identify and you have to inform. And then another 14 days after that resolution, minimally, before they can come back to work. Now, look, we don't know. Some people are starting to say maybe they can return to work sooner, as soon as the fever breaks. I read one report that was advising healthcare workers to go back 5 days after resolution of fever and other symptoms. We just don't know the other side of this, but that's the 14-day quarantine. So remember that if they're diagnosed, or presumptive diagnosis is also starting to be talked about legally, the 14 days prior to, who did you have contact with? That's the contact tracing element of this. And then you're now quarantined for 14 days until we can determine if you actually have it or not, which of course, in most instances, they're going to be, testing positive, hopefully right away. Again, don't identify by name. I think that's where most of the people got in big, big trouble with SARS, is they said, hey, Ernie was diagnosed with SARS, and so we got in trouble. If you witness symptoms, you have to send them home immediately. There's clear legal precedent that if you allow a staff member to remain in your clinic when they are displaying symptoms of infectious communicable diseases, you are liable. Okay. Now, what does this liability mean? I mean, you're probably not going to be sued even in civil court, but this could, if somebody challenges, this could affect how your reparations, how your compensations, maybe from a federal or state or even a local mandate are. We don't know, but we do know that this is one of those areas where the law is very clear. If you witness a febrile employee, and yes, you can ask to take the temperature of your employee. Clear legal precedents. OSHA allows that. In fact, they've been very clear in some of their communication with business owners during this recent pandemic. But if you witness coughing, if you see, any other symptoms, or you hear about the symptoms, you have a legal obligation to send them home. Just be aware, because now all the other employees are going to say you created an unsafe workplace. When to return to work, as I mentioned, there's a little bit of ambiguity. I was very clear on this. A doctor's note. Honestly, we are not human healthcare officials. We're not law experts. So until somebody tells me who is in that authority, has that responsibility legally, until they say this person is okay to return to work, I think you should be very, very cautious. And we're going to have this. Look, we have the most dedicated, loving, committed, compassionate employees on the planet. And they're going to start feeling better. They're going to be like, I don't even think I've got it. Let me come back to work. I know how shorthanded you guys are. If you allow that, this is where liability starts to become an issue for you. So just be really, really, really careful. Getting back to this written policy, you should hold a training session, as I mentioned. You should have a written policy. Then you should document in writing this training. This is very, very important, because on the other side of SARS, there were a handful of cases that people claimed they were not instructed, that nobody told them. So obtaining signatures from employees for all new and amended policies, you definitely need to be clear on this for sure. Again, I'm just kind of going through this thing. Protecting our clients, another big issue for sure. Be sure to provide adequate hand washing stations, hand sanitizer, any needed personal protective equipment for your clients during this pandemic. Let's see. And I know we're going to be getting some questions. I've been trying to do this. Is contact within 6 feet or in the same hospital? Yeah, it is. It's actually working in the facility. And so that's a great question from Tricia Hunt. Thank you very much. So part of the contact tracing is you ask the employee who's been diagnosed or is displaying symptoms. And again, right now they're saying disclose that presumptive diagnosis. That's why you're starting to hear in the news, we have 3 new presumptive positives, because again, they're waiting for the CDC to confirm that case, or starting to allow state health agencies to confirm those tests, from what I understand. But yes, anybody they've had contact with, and contact is within 6 feet. Doctor's note, yeah, or negative test, Laura, I got that. Yeah, we already established that a doctor's note is really what we're looking for before you return to work, And again, I don't believe a negative test alone. I think that their personal physician should carry the full culpability for returning to work. Again, I want you to be abundance of caution with this, returning to work. And I know if you're techs or anything like my employees, then they're going to be desperate to come back and do their part and get up back on the front line. And this is just an area that we can't allow them to. I would encourage you right now to be very clear. I've seen many of our members already do this. Be very clear with what steps you are taking to protect your staff, your pet patients, your clients from COVID-19. Many businesses have done some beautiful jobs articulating this. Right now, I would encourage you on social media, on your website, on email, whatever you can do to as many people that are your clients as possible, inform them on what you are doing. I think this is not so much, again, a legal issue, but is one to reassure the public that veterinarians take this very seriously. So, I think that that's the least you can do. Laura and I have really been working with a lot of local businesses in our area, and we've been trying to advise them on what to do and what not to do. And I think that most of them are heeding the advice to at least tell the public if you're open or not. Probably shouldn't be open, but to make sure that you share with them the steps that you are taking and give them alternatives, which we'll talk about now as well. Okay. We talk about protect each other from share. Keyboard. Yes. We got a question about a sick child. Yeah. What if a team member has a sick kid? Can't keep them from coming to work unless a positive test. I'm going to get to that in just a couple of minutes about children, and the federal legislation actually has a provision in there for that. But in general, if they have a sick child, can you keep them from coming to work? That is going to be kind of your call. Right now, the federal government is saying that person in particular should stay home with any sick child, and they were very clear on this. If a child's school is closed due to the COVID-19 pandemic, or if they're caring for a sick family member, then they're qualifying for sick leave. And again, this is something that we haven't seen before. Great question. Really good. Keep them coming. Clients with COVID-19, I would also, as part of the communication with your clients, say, if you've been diagnosed, if you're exhibiting symptoms or experiencing symptoms of COVID-19, please let us know. And I think that can start a conversation that do you have anybody else who could bring your pet? Is there some way we can come, and help you? And the reason this is really important is because, as we'll discuss in just a second, I did an article and a video on this back at the beginning of this thing, 2 or 3 weeks ago now. We know clearly that dogs can serve as mechanical vectors. I know someone had used the terminology fomite. That's a fine too. Mechanical vectors, whatever. The virus can reside and live and be viable on the dog's skin and fur, and perhaps even in the mucous membranes. And so we want to be very, very cautious. So if that client has a dog that, and they're diagnosed, remember that dog is now under quarantine, which is something that we will probably need to discuss in a later Facebook Live, is making sure those people, and I'm calling this quarantine care, right? I think a lot of pet owners don't understand the seriousness of a quarantine. That dog cannot be walked outside. I mean, this is very, very serious, and we're going to need to create content for that. So again, if that's stuff you're interested in, let me know, let Casey know at VerticalVet, and we will start to put that out. But I've been working on this quarantine care guide because right now, based on the current models, it really gets started next week. If you look at where we are in the progression based on Italy, South Korea, China, France even, next week is when it starts to get real. So I think we're all going to have a very different answers to some of these questions. Limit the number of people in the building, treat pets in the back. I mean, all of us are doing curbside. I think, these are well-established strategies that we've been doing for years during a variety of outbreaks for zoonotic veterinary diseases. So we are really good at that. But I want to make sure that you are doing everything you can to remove the risk to your staff from the pet. I think that gloves, N95 masks, gowns, caps, I mean, you really want to reduce the risk of you carrying this virus onto a family. And if you've seen Munster's latest data, Munster was one of the NIH researchers, published a paper 2 or 3 days ago now. And I think, Laura, I kind of had some of the Munster data. But when you look at how long this virus is viable in a variety of surfaces, as a general rule, 24 hours is like kind of a safe bet. And if that virus comes in contact with a counter, just assume 24 hours of viability. Now, obviously, there's a viral load and so forth that accompanies whether or not somebody will get that infection, but this thing persists in the environment. So it's not like, oh, wow, the wind blew or the sun shines and it's dead. It's not quite as easy as that. And I wish it would be. Okay, pet fur, stress and anxiety of our staff. I think I've really tried to lean into this. I think a lot of us are concerned. I think a lot of our colleagues are confused. I think a lot of us want to keep doing the thing that we love the most, which is helping pets and the people that love them, but we wonder at what cost. Are we risking our family's health? Are we risking the health of the people that we love in our clinics? Are we risking the client's health? And I think that these are real stressors. And so we are on the front line. And I think that you really need to make sure every day you're doing something to check in. Wellness is very, very important. And honestly, it can be something that your managers, that your owners, that your senior leaders in your team just quietly pull people aside, say, how's it going? Is there anything I can do to help you? It can be those little moments that may just help them. People need a safe space to unload and vent. They may be nervous about a grandparent, a parent, a loved one. So I really want you to take into account that your staff may be dealing with this in a much more profound, impactful fashion. I think that as this carries on, and again, as I mentioned, when you look at these projections, this is till the end of April. That's nearly 6 weeks, kind of at minimum, that I think we're going to be in almost lockdown conditions. So I want us to make sure that we pay attention to that. All right, let's get into some of the stuff I know you want to talk about. Staff shortages and scheduling strategies. You're going to see a shortage in staff. And I'm going to tell you there's 2 ways to look at this. One, it's going to be imposed by the COVID pandemic. Number 2, you're going to get smart and try to flatten the curve within your clinic. And I started talking about this 2 weeks ago about flattening the curve in your clinic. And maybe I haven't been clear articulating what I'm trying to say. Let's say you have a staff of 10 people. Based on all the current models and projections, 5 to 8 of those people are going to contract this infection. That means you're going to be down throughout a period of time, half of your staff or more. Okay. Number 10, lose half, maybe more. And if I were you right now, I would be establishing strategies where you say, look, we are going to go ahead and reduce voluntarily. Everybody's still healthy, but we're going to reduce voluntarily, and we're going to start to say, go home, self-quarantine, and we want to do shift work. Only have 5 people in at a time, or whatever you can do. Because remember, this is a bit of a game of chance. We just don't know who's carrying it. We don't know at what point in time the contact will be in proximity to allow successful transmission. So what you should consider is flattening the curve within your team, because if we know that over time we're going to all be infected, okay, by the end of the year, CDC is projecting, again, 2/3 of Americans are going to be exposed. That doesn't mean they all get sick and are out for 2 weeks. Well, they may be out for 2 weeks on mandatory quarantine, but it doesn't mean they go to the hospital or ICU. But it does mean that we may be having these periods of time where we are short-staffed. So I would encourage you to try to prolong that duration. So maybe, we don't get hit. What you don't want, and we had this happen during one of the flu outbreaks at our clinic years and years ago, you do not want to go down and suddenly wake up and find that 80% of your staff calls in sick. Laura and I were there. That is a real challenge. What I would rather do is say, you know what? Over the next 6 weeks or so, I'm probably going to be dealing with diminished capacity. Appointment density will suffer for sure. And so I'm going to say I've got a diminished capacity and try to see if I can't stay afloat. I'd rather be working, and I was talking to a veterinarian about this last week. Sort of my argument on this is when you talk to your staff, go, look, we've got a couple of ways to play this game. We can risk really me having to lay off permanently staff. This could take us years to recover. Now, heaven forbid, I don't think that's going to happen. I think we're going to have a V-shaped recovery. I'm still very optimistic in the fundamentals of our economy. But if this thing goes on and on and on, and if we're actually talking about the end of the year, as some forecasts show, we're dealing with this, well, then that V curve doesn't happen for recovery. And so I would really like for us to say, how do we sort of operate in this newer normal? And I don't even know, I think if your appointment density or demand continues to stay high, you can still do a tremendous amount of care with a limited staff. And remember, right now, I think we're this close to having, real strict state and federal mandates on what we can and cannot do, which we will talk about that in a second. Just real briefly, the Families First Coronavirus Response Act, as you know, that was signed into law by the White House last night, but it doesn't go into effect until April 2nd. I think a lot of people think this is happening immediately, but it does not happen until April 2nd. So none of this actually is going to impact us for the next couple of weeks for sure. There's Laura, you can start to share some of the sort of take-home messages. I think I would like to save this for another Facebook Live. But I know we talk about what does this cover? Kind of the big things. Number one, they expanded who would be eligible for benefits. It used to be 50 employees or below. They expanded that to 500. That's a big deal for a lot of sort of mid-sized companies for sure. The other thing that's important to note is that the length of employment was reduced dramatically from the House bill to 30 days. So the law actually says if an employee's been working with you for 30 days, they're going to be eligible for these benefits, which do require you to pay up front. You're going to remember given a tax subsidy, a tax break on your Social Security tax at the end of this, but we're still going to be personally having to float these employees for a while. I think some of the other key provisions that I want to kind of touch up, and I know Laura will be kind of sharing some of my notes in the comments, but 12 weeks of job protected leave. And what that means, and there's a couple of provisions and exemptions, I should say, for part-time workers around that. But in general, your full-time employees, if they get out for whatever reason, take care of a loved one, they get sick themselves, whatever, it's a 12 weeks of protected leave. It doesn't mean you're going to be paying them for that full 12 weeks, you personally, but you have to provide that their job is there when you get back. Just want to check it out. Paid leave. The first 10 days, as I mentioned, the first 10 days of emergency FMLA, Family Medical Leave Act, may be unpaid. Now that the House bill was a 14-day, so a 10-day, that's good. During this 10-day period, an employee may elect to substitute any accrued paid leave, such as vacation or sick, to cover some or all of the 10-day period. After the 10-day period, the employer generally must pay full-time employees at 2/3 the employer's regular rate. Again, they're sick, they're out of work. For the number of hours the employee would otherwise be normally scheduled, the act now, it did limit it to $200 per day. I believe the original House bill might have been slightly different on that. I can't remember the exact amount. $200 per day and $10,000 in the aggregate. Again, tax credits, these tax credits are allowed against the employer portion of Social Security taxes. You're going to get 100% of that back. The qualified sick leave wages, change. You guys get that. And I do, I think we should have an accountant, a legal, because this act is a little trickier than I had hoped. I think by and large, this is great. This is great news for us as small business owners. I think it's going to really help us keep afloat our employees. But having said that, there are a lot of fine details. And remember, these are given in the form of tax benefits on Social Security. So just be aware, it's not just like they're getting a check. Now, the Senate bill that was floated tonight, as you know, was saying $1,200 per adult. We'll see how that kind of plays out. Okay, so a lot of details with that. I now want to really try to dig into some questions. And so, Laura, I'm not sure if you or Casey saw any good questions that you'd like to highlight or you'd like for me to highlight. But if you've got any questions, let's talk about it, because I think there are two things I want to know from you guys. And if you don't mind sharing it, in the comments, what's your biggest concern about the COVID-19? And again, let's not try to get into the specific legalities of some of these forthcoming laws and mandates, but I really want to, what are you most worried about? Is it losing business? Are you worried about going out of business? Are you worried about losing all your staff? I've got some opinions that I'd love to share, but I want to hear what you want to talk about. Okay, so don't allow them to come out to work without a doctor's excuse. Right. Yeah, Brandy, I think that's my best advice right now, because we don't know. Every state has had slight tweaks. If you look at the Washington State Health Department advice, it was sort of like they were saying, well, for healthcare workers, 5 days after resolution of symptoms, including fever, then they're checked for a fever a couple of times a day at the hospital. I mean, all of that just speaks to me, wow, that's a real technical aspect they don't really have answered. So if a doctor signs off, their personal physician says, you're good to go back to work, that's where I think we should start to set the bar. The federal and state governments may come in and say, this is already being discussed at large. And when can they come back to work? When can they come back to work? We're just in the start of this. We don't know. But state health officials may actually say, when we give you a negative test, you can now return 72, 5 days, whatever afterwards. Okay. If an employee chose to travel, chose to travel regardless, what would you do? Let's see. Laura, what is that one about? MJ, yeah. And again, I mentioned earlier in one of the articles was just the responsibility that we may have to make sure that we are asking our employees. I would encourage you to go and talk to your employees and say, look, do you have anybody in your family, in your immediate, circle of contact that has an immunocompromised condition, that is elderly? I wish people were asking me that, because the last thing I want to do is transmit it to my mother, because my mother is like many of those very high risk individuals where if she contracts it, I'm very concerned about it. Okay, running out of supplies. Oh yeah, great question. Okay, so many of you guys know that I also started a pet food company a couple of years ago, and we have been asking this question to all of our suppliers and distributors and shipping and logistics. And right now in the US, we seem to have, and again, let's not get into masks and ventilators just yet, but most of the supplies that you and I use, the consumables, there's about a 2-month supply of almost everything. I think where we really start to get concerned is what does it look like in June, July? I was having a conversation recently with a group of other veterinary business owners, and I said, look, right now, I'm not expecting these massive shortages, masks and other consumables that are in high demand for the human healthcare system. Absolutely, yes. But for the generic drugs, the heart preventers, all that stuff, where we're going to get pinched is probably going to be June, July, August. Because remember, we've had supply disruptions from China, significant shutdowns over there for nearly 2 months in some instances. And that backlog is what we're going to see the impacts rippling over. So even if everything goes swimmingly here and we're doing much better by the summer, we're going to experience most likely some shortages. Because remember, it takes a while to ramp back up, to produce, to box, to ship, to clear through customs. I mean, it's not just like China can overnight it. It's not like Amazon. So yeah, that's a great question. I think if I were you, I would also be very cautious with how I'm using the PPE in your clinic. I was asked this recently. We are not going to be the top of the list. In fact, I think you're going to start to see some distributors say, look, we're going to have to limit you to 1 case of mask or 1 case of gowns and caps, because the priority, the clear mandate from the federal government is that all of these are essential supplies for human health care. And so we're definitely not going to get that. Yeah, but general supplies, I think we're okay. I think anywhere we overlap with human healthcare essential needs during this first part of the demand, that's where I'm worried about. But, I would really encourage you to take a look at some of these articles, because I'm trying to paint the picture that a lot of the stuff we get will be fine in the immediate future, and people are going to have this perhaps false sense of security. I'm actually more worried about what happens in June, July, August, and perhaps even further to our supplies. This is really good. Okay. Yeah, a lot of questions. Good. Yep, already seeing a shortage of certain prescription pet foods, and that's what we've been looking at too, Kevin. And those are primarily disruptions or delays, I should say, in logistics. Right now, the warehouses are full. So the fulfillment centers have got, really the next 4 months of most pet foods in stock. Obviously, certain SKUs are always going to be, a little bit thinner, so we may see some issues there. But in general, it's actually getting it out. And so even on our ingredients and supplies that we need for our food, we're actually saying, they're telling us now, look, expect 2 to 3 week delays, and actually even then just production, which we'll get into. FMLA applies to businesses of what size? According to the law signed last night, businesses fewer than 50. So yeah, that's us. So nearly everybody else. There are a couple of little hiccups in there. If you're less than 25 employees, there's a little more favorable as far as some of the job restoration provisions. So if you're under 25 employees and you lay off an employee during this pandemic, and you then do whatever reason, you can't hire them back, and you do have to make a case for this, then you'll have slightly different rules than business over 25. So that's one of those little minor details that we're trying to do it. Okay, good question. What's this? Oh, we got lots of questions coming in from all over the place. Okay. I have a hospital in my area that's asking for donations for PPE. I feel an ethical responsibility to provide those donations, but I'm scared that I'm going to run out. Yep, I feel you. These are the ethical pains that we're all going to experience. And I don't have a great answer for you. I would say that as far as your personal belief here is that, it's kind of like I do prioritize the lives of the dogs and cats. And so if I had an abundance of it, if I said, wow, I've got enough to get me through the next 4 months, I somehow got them on sale, I stocked up for the whole year, then perhaps I would donate some. But I do think you have to say, okay, I get it, guys. But if pets start going down, personal here. I believe that pets are we're gonna have renewed enthusiasm and bond with the dogs and cats that we share our homes with. All of this work from home is just going to prove to tens of millions of Americans that, and worldwide, hundreds of millions of people, that pets bring so much to their daily lives. So I will say this, for me on an ethical standpoint, I'm going, look, I can't let these pets go down. I can't fail the pets, because if it's a healthy individual and they lose that support, wow. Okay. So I know that's not a great answer, but these are the dilemmas we're all going to have to settle with. Okay. Another question here. All right. If one staff member tests positive, does the rest of the team have to quarantine? Great question. This is where the contact tracing comes into play. Right now, this is a state by state, and even in some instances, local municipalities. So if you look at like the counties in Northern California, they're all taking it upon themselves to set some of these guidelines. Typically, it goes like this. If you are not displaying any clinical signs, have a fever or whatever, even if you're an N of one degree removed, then you're okay. You're going to be okay until you test positive or develop symptoms of this. So you don't have to send everybody home. The health department is not going to come in and close you down. In fact, the Washington State, which again, remember, Seattle was one of the first sentinel cities of this. So we're kind of getting a lot of information of how they've handled it. Northern California, especially Santa Cruz County, is really taken some very aggressive steps towards this. So we're just looking at them for guidance, because I will say right now, I wish we had more guidance from the federal government. I think it's about to happen from all the rumors on the epidemiological boards. But yeah, so we really need, right now it's just a patchwork of rules and regulations. But the rest of your team doesn't have to quarantine. They do have to start to monitor themselves. If they had really close contact, if they develop any symptoms, that's when you start to quarantine. It's a great question, but you need to check with your local health department. They might say something different. So anything we pay in sick leave, we'll get it back as a tax credit at the end of the year. Okay, so remember there's that 10-day that's exempt from this. So right now, the current understanding of the law that was just passed last night. So again, a lot of legal analysts are going to be going through this, and a lot of payroll experts are going to be going through this. And that's why I think we should have this next week to discuss some of these things in more detail as we have clarity. But right now, you've got a 10-day period. And then after that, that's when it sounds like these benefits begin to kick in. I think, Laura, we put up a lot of those details, right, about the job restoration and the Family Medical Leave Act changes. So again, check the comments. I tried to summarize a lot of the flurry of activity that's coming out. I do want to, and again, if you guys have to jet off, we totally get it. We're going to try to run this at about an hour, and then we'll take it there. How to handle overnight care. This is the question that I've been getting more than anything. And that is these people that have, there's two scenarios with these. One, there are people that actually stay, live, reside part-time. It's like, well, do the doctors still sleep here? We've got like a little, couple of bunks and so forth. My advice is no. My advice is I would probably be very, very cautious with that. But again, it's up to each person and their own level of comfort and care. But I think that right now, the way it's looking, especially when you look at what's happened, and I keep referring to France, but France is more similar to us in many ways. Obviously, their prescription drug laws are very, very different, and some of the scope of services that they can perform in France versus U.S. is different. But in general, what has happened there is they've shut down everything but emergency care. So I think that what's going to happen is in most cities, we are going to be held only to emergency care. I don't know what that means in the United States, because many of us are in rural areas like me. I mean, where we perform our own emergencies for many years, or is it an undue burden for a person to have to drive an hour, 2 hours to an emergency care? None of this has been settled yet during a pandemic time, but I can tell you where the law sits. Clearly, the precedent is this: if you are risking endangering the public's health, then you shut it down. And so I think we're gonna have to be really, really careful watching what this going. I love this, Tricia. We're a one doctor practice holding your own. Yep, just like everybody can do. We're reducing our surgery cases because it's impossible now to provide the overnight care. Yep. Will the larger animal hospitals be allowed to stay open and provide care for the animals at all levels of required care? I don't think, again, it's going to be like larger. I think it's going to be the scope of services. I think that right now, as many of you know, I week and a half or so ago said, look, I would start to shut down your elective procedures. I think these are the types of issues that I'm most concerned about. All right, we got another one coming in. We're getting text messages. Okay. When, if ever, great question, does it ever make sense to lay off the majority of my staff so they can receive employment benefits? I'm afraid I won't be able to support my team financially if I see a continued decrease in appointments. So this is the old proactive lay them off now. You remember that flattening the curve that I was talking about? That's a more reasonable solution, in my opinion. You have to rally your team and say, look, this is what we're facing with. Because let's just paint the scenario. This is a clinic that says, look, I don't have enough cash reserves. I can't pay people. I can't survive 2 weeks, perhaps. And again, we're just getting into this. And they're saying, I'm going to go out of business because I can't make my payments in 2 weeks. And I'm sorry to hear that if that's the case. But the reality is this. One, you're really not supposed to use unemployment that way. So given these trying times, you're probably going to get away with it. But remember, you're still going to have to pay them all 10 days. It sounds like, that's what the current interpretation of the act that was signed last night is. You're still going to be minimally responsible for 10 days of paying them, at least 2/3 of their salary. So I would just encourage you to figure out a way to work with your team and say, look, here's what we're facing. We're going to have to reduce hours before I start laying them off. I will tell you one thing right now, and I'm not going to name a name, but I got a text message from a very, very large group of clinics across the country, and they are going to be amping up their benefits, their pay, their sick. They're already giving signing bonuses up to $60,000. So there's going to be an opportunity for some people to gain here. And I'm working on a piece right now to talk about practice valuation and what I see on the other side of this. And that's a very complex question that nobody knows. But I want to say to you that if you're dealing with, like, should I lay off all my staff now? I would really encourage you not to. I would really encourage you to work with them in some way to say, how can we get through this together? Which one? Okay, yeah. Brandy, the dental community is closed and sent everyone to unemployment. Would it be safe if needed before anyone gets sick? That's not the plan. Yep, I love it, Brandy. And in fact, in some states, they've already mandated that, like, general dentist practices close because they've deemed it non-essential. That's a little different scenario. So if the government comes in and says, look, general veterinary practice, like mine, like many of yours, you have to close down or you can't provide these services, then yes, that's the time to actually go into unemployment. But Laura, you were saying you got another question? Okay, yeah. So I'm the dentistry. I can tell you, if you just Google some of the dentists that are out there, this is a real challenge. So Brandy, I don't have an answer for you on that one. I mean, this is a tough one. It's a tough one. I just, again, personal belief is that we try to use unemployment for when it's absolutely necessary. If you're facing these really trying times, I'm looking at flattening the curve, reducing my staff cost right now. And, again, trying to say, I want to keep you guys as healthy as possible for as long as possible so that we don't get to those more dire or extreme circumstances. All right. Any other questions, Laura? Let's see. My dogs among my coworkers last week, MJ. That's the opportunity here. Now, the opportunity is telemedicine. So if you definitely go check out that article I wrote, it's a good, thorough investigation of what I've been saying, for many years, but this is going to accelerate it. Like right now, Americans, remember, here's what happened last week. The Medicare system said to all seniors in the United States that we will cover your telemedicine visits with your doctor. Your doctor, we know you may not have it set up. You may not be on eVisit or some of these other platforms. Use FaceTime, Skype. We will still reimburse you. This was joy to people like my mother, who's scared to death right now during this time. She knows she needs to talk to her doctor, but she's like, I'm not going to go down there. And I told her not to go down there. But now she has the opportunity to FaceTime, and we're working on FaceTime, but we're getting there. But this is a great opportunity. What that means is that millions of Americans are going to be exposed to this. And on the other side of this, they're going to say, why doesn't my vet offer this? So if you're interested in doing a Facebook Live, let me know. But definitely, I can help you with some of this stuff, and definitely check out that article. But you can help your clients right now. And again, I don't want to get into all the legalities, but if this is your established client, you already have a VCPR, and again, the North Carolina State Medical Board here said, in their wisdom, said, if you'd recently seen the pet, I'm sorry, recently is 10 years? I mean, 1 year? It's ridiculous. We need more clarity. But the reality is this: if you've seen them, you have a VCPR, you're comfortable seeing them, this is great. Telemedicine is awesome for things like skin allergies, for osteoarthritis, for very, very minor illness, GI upset, things like that. You can prescribe, you can dispense. So again, I'm going to challenge, and you're going to see a lot more content. If the state veterinary medical boards don't get behind this, we're going to look so behind. The public is not going to trust us. We're going to see all of these teletriage services come in. They're going to have a disappointing experience with them because, as I mentioned, over the years, really most of the telemedicine, this is what they can tell the client. Go to the emergency clinic now, or go see your vet now, or it can wait till the morning. And that's just not what they're doing. My mom isn't going to reach out to her pulmonologist, for them to say, make an appointment tomorrow, go to the emergency room tonight. She wants to actually have a real meaningful, okay, breathe in, breathe out. I mean, it's pretty cool. It's pretty cool. So, all right. I love it. I think it can only be used if they haven't contracted the virus, from my understanding. Brandy, yep. That's, yep. So if they've contracted the virus, you can't really lay them off. That's where it starts to get into all these little sticky legalities. So great point, Brandy. Great. Yep, MJ is already using a program like that. So, I love it. I think I'd really like for you to read that article. I think if you're new to this, there might be some reasons not to use a third party at first. All right, Laura, any other questions that are coming through? Are we about wrapping up? All right. So guys, again, don't expect to get all of your answers tonight. Don't expect all of your answers tomorrow. The only answers that we're going to have is when this thing is over and done with. And when they do the autopsy on this pandemic, that's when we learn and prepare for the next one. And I will say this, having been in practice now, for nearly 30 years, you see these types of occurrences, and you just wish that our memory was a little longer, that we learned the lessons a little better, and that they carried us forward, because a lot of this feels like, reaction to some things that we'd already seen before. And so as a profession, it's a time for us to rally. It's a time for us to promote what we do, the benefits to society that we provide, and just really love the people that we serve. As I mentioned before, really take care of your people. Your priority right now, in my opinion, is to protect your staff. Not just their physical well-being, but their mental health as well. So do whatever you can to give them that support and guidance. Many of these people are very, very strong, but they've got so many stressors in their lives that they aren't really able to share openly. It wears on them. And I really want us to be that nurturing source for them. So again, I know that's kind of waxing on, but we'll get going. All right, let's see. We got one more question. What fixed costs should we look at adjusting? Everything. I mean, fixed costs here, this is where, look, maybe you're going to have some opportunities with refinancing, right? I mean, mortgage rates are about to be at historic lows again. I mean, maybe there's something you can do to reduce electricity. I think reducing hours here is going to do that. I mean, but your fixed costs are really, let's always focus on the two big ones, right? And that's going to be staff salaries and benefits, and that's going to be inventory. And so I was really trying to push. I think what vets need to do now is be very, very strategic about what money they are spending. Make sure you're spending money as efficiently and as profitably as possible. But yeah, I mean, a lot of our fixed costs are just going to kind of, it's not a lot we can do to move them. I think you'll get some, downward inflection on certain things. I think that, but by and large, look, this is a time when you want to try to maintain revenue. And I'm going to say the best way, and really the only way that we're going to really be able to boost our services, is going to be through telemedicine. All right. Oh yeah. Great question. Yeah. Staff volunteers. Before you lay them off. Tough question, because there may be some risk there if they become infected. But and Laura, maybe you can give me some context on that question. Was there any more?
Well, no, just asking for.
Yeah, so I think the question's probably around, okay, I have some staff members that would be willing to, volunteer not working, right? To maybe they're older, semi-retired, something like that. I know we had that during the SARS outbreak, where we had a couple of our older part-time-ish people, 3/4 time really, but where they were like, look, I don't this isn't my whole livelihood, so I'm willing to take, a week off here or whatever. So yeah, I mean, those are the kind of strategies that will work for sure. All right. Well, guys, I really wish that I had all the answers. We don't. I want you to please be safe out there. Please give your pets a hug from me. And more importantly, just remember, we will get through this. This will just be a chapter in the books of our lives, and you're going to look back on it and you're going to say, I learned a lot. I grew a lot. We survived. We are Americans. We are veterinarians. Nobody is more capable of getting through this chin high, chest out than us. So again, on behalf of Vertical Vet, I'm Dr. Ernie Ward. It's been a pleasure speaking with you tonight. Remember, we're going to continue this conversation. If you're interested in maybe doing something else next week, let us know. Until next time, be safe, friends. Bye.